I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney, and welcome to this part 2 on keratoconus fearmongering. Fearmongering is huge in medicine today, unfortunately. There's a lot of patients told, if you don't have X, then you will suffer Y. Basically, every operation that you may ever think of having, almost all of them are purely elective. If you don't want it, the answer is simple, don't have it. With keratoconus, the reverse is what patients want to know. When should I have treatment? Well, if you do want to fear something in keratoconus, it's your own hands, because rubbing will make you get worse. If you stop rubbing, 95% of the time, you won't deteriorate. So when do you need to consider treatment? Here's what I've noticed over the last 20 years. When people have very severe keratoconus, they can still deteriorate. And that's because the front of the eye is so badly stretched, it's like an aneurysm. An aneurysm is when a blood vessel stretches and bursts. And you'll hear of people dying of an aneurysm of the brain. Think of blowing up a balloon. If you go to blow it up, it's hard initially, but as it stretches, it becomes easier. As you stretch the front of the eye, it will continue to stretch whether you rub or not. And you get to a point where that stretching is so bad that the actual front of the eye, the cornea, can rupture. So in advanced cases, I will tell patients, listen, don't leave it too long, your risk of rupturing is going up. And the other time it becomes sort of semi-urgent is if it's getting worse, the worse it is, the harder it is to fix. But none of those require urgent treatment now. You can go home and think about it. The clock isn't ticking, you've got time. So that's about it. There is no fearmongering in keratoconus. Please don't feel that you're going to go blind. You won't. If you have any questions at all or you're concerned, we're happy to see you. Thanks as always for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.